Hey everyone, welcome to your nursing space. I'm Nurse Mark Johnson. Today's video is powered by ExamASAP, the industry's leading exam practice platform. Head to YourNursingSpace.com for all the details. Quick tour, log in, click Create Tests, pick Tutored or Test Mode, choose your topics. We're doing a mixed set today. Set your question count, then hit Start. Rationales pop up right after each answer. Let's get started with today's NCLEX style questions and rationales. There is an audio-enabling effect on this platform, so it can generate audios for each questions. Without further ado, let's get started.
A nurse is caring for a 72-year-old client who has been admitted with exacerbation of chronic obstructive pulmonary disease, COPD. The client is experiencing increased shortness of breath, wheezing, and a productive cough with green sputum. The nurse notes that the client's respiratory rate is 28 breaths per minute. Oxygen saturation is 88% on room air, and the client appears anxious and fatigued. The healthcare provider has ordered a nebulizer treatment with albuterol, a chest X-ray, and a complete blood count, CBC. What is the best initial nursing action to take in this scenario? Here are the options. Option 1. Administer the nebulizer treatment as ordered to relieve bronchospasm. Option 2. Obtain a CBC and chest X-ray to assess for infection and complications. Option 3. Place the client in a high Fowler's position to facilitate breathing. Option 4. Provide reassurance and educate the client about COPD management. The correct answer is administer the nebulizer treatment as ordered to relieve bronchospasm. In this scenario, the client is experiencing significant respiratory distress with low oxygen saturation and increased respiratory rate, indicating a potential exacerbation of COPD. The priority nursing action is to administer the nebulizer treatment with albuterol, as it will help to open the airways and improve the client's breathing. While placing the client in a high Fowler's position can help facilitate breathing and providing reassurance is important, the immediate need is to address the bronchospasm. Obtaining a CBC and chest X-ray are important, but they are not the priority action in this acute situation. A nurse is caring for a patient who recently underwent surgery for colorectal cancer. The patient is now showing signs of septic shock with hypotension and tachycardia. Which of the following interventions should the nurse prioritize? Here are the options. Option 1. Administer prescribed antibiotics. Option 2. Monitor vital signs every 15 minutes. Option 3. Prepare for possible blood transfusion. Option 4. Administer intravenous fluids as prescribed. Explanation. The correct intervention to prioritize in a patient showing signs of septic shock, such as hypotension and tachycardia, is to administer prescribed antibiotics. This is because septic shock is primarily caused by an infection, and antibiotics are the first line of treatment to combat this. Monitoring vital signs every 15 minutes, option 2, is important, but it does not directly address the underlying infection. Preparing for a possible blood transfusion, option 3, may be necessary in some cases of septic shock, but it is not the initial priority. Administering intravenous fluids as prescribed, option 4, is a supportive measure to maintain blood pressure and perfusion, but it does not treat the infection. Remember the mnemonic ABC, antibiotics before other care in septic shock. This helps to remember that treating the infection is the first priority. A nurse is caring for a 72-year-old client with a history of chronic obstructive pulmonary disease, COPD, who is admitted to the hospital with acute respiratory distress. The client is currently receiving oxygen therapy via a nasal cannula at 2 liters per minute. Upon assessment, the nurse notes that the client is exhibiting increased respiratory effort. Using accessory muscles, and has a respiratory rate of 28 breaths per minute. The nurse also observes that the client's oxygen saturation is 88% on the current oxygen flow. Considering the client's condition and the potential for further deterioration, what is the best initial nursing intervention the nurse should implement to improve the client's respiratory status? Here are the options. Option 1. Increase the oxygen flow to 4 liters per minute via the nasal cannula. Option 2. Place the client in a high Fowler's position to facilitate lung expansion. Option 3. Administer a bronchodilator as prescribed to relieve bronchospasm. Option 4. Notify the healthcare provider of the client's deteriorating respiratory status. The correct answer is place the client in a high Fowler's position to facilitate lung expansion. While all options may be relevant in managing the client's respiratory distress, the best initial intervention is to place the client in a high Fowler's position. This position allows for maximum lung expansion and can help improve oxygenation. Increasing the oxygen flow may not address the underlying issue of respiratory effort, and administering a bronchodilator should follow positioning. Notifying the healthcare provider is important, but not the immediate priority in this acute situation. A nurse is preparing to discharge a patient who has been treated for pneumonia. Which of the following statements made by the patient indicates a need for further teaching regarding home care and follow-up? Here are the options. Option 1. I will complete my entire course of antibiotics. Option 2. I should return to the doctor if my symptoms worsen. Option 3. I can stop taking my medications once I feel better. Option 4. I will make sure to follow up with my healthcare provider in 1 week. Period. The correct answer is, I can stop taking my medications once I feel better. Enhanced explanation. The correct answer is, I can stop taking my medications once I feel better. This statement is incorrect because it is crucial for patients to complete the entire course of antibiotics, even if they start feeling better. Stopping antibiotics prematurely can lead to a relapse of the infection and the development of antibiotic resistance. Option 1. I will complete my entire course of antibiotics is a correct statement. It shows the patient understands the importance of completing the full course of treatment to prevent relapse and resistance. Option 2. I should return to the doctor if my symptoms worsen is also correct. It indicates the patient understands the need for medical attention if their condition deteriorates. Option 4. I will make sure to follow up with my healthcare provider in 1 week is correct as well. Regular follow-ups are important to monitor recovery and address any potential complications. Remember the mnemonic ABC, always be completing your course of antibiotics, to help remember the importance of finishing the prescribed medication. A nurse is caring for a patient with a history of asthma who is experiencing an acute exacerbation. The patient is prescribed a nebulizer treatment. Which of the following actions should the nurse take first before administering the treatment? Here are the options. Option 1. Obtain a peak flow measurement. Option 2. Assess the patient's respiratory status. Option 3. Educate the patient about the procedure. Option 4. Check the medication order. The correct answer is assess the patient's respiratory status. Explanation. The correct first action before administering a nebulizer treatment to a patient with an acute asthma exacerbation is to assess the patient's respiratory status. This is crucial because it provides a baseline of the patient's current condition and allows the nurse to determine the severity of the exacerbation, which will guide the subsequent treatment. Obtaining a peak flow measurement, option 1, is important, but it's not the first step. This measurement is used to monitor the patient's lung function over time, not to assess immediate respiratory distress. Educating the patient about the procedure, option 3, is also important, but it comes after ensuring the patient is stable and able to comprehend the information. Checking the medication order, option 4, is a necessary step before administration, but it's not the first step. The patient's immediate physical status takes precedence over medication verification. Remember the mnemonic ABC, airway, breathing, circulation, to prioritize nursing actions. In this case, assessing respiratory status, breathing, comes first. A nurse is preparing to administer a blood transfusion to a patient with a history of chronic anemia. Prior to starting the transfusion, the nurse must ensure that several safety checks are completed. Which of the following actions should the nurse perform first to minimize the risk of transfusion reactions? Here are the options. Option 1. Verify the patient's identity using 2 identifiers. Option 2. Ensure the blood product matches the patient's blood type. Option 3. Obtain vital signs before initiating the transfusion. Option 4. Infuse the blood product through a Y-set with normal saline. Option 5. Explain the procedure and potential reactions to the patient. Explanation. The correct action for the nurse to perform first when preparing to administer a blood transfusion is to verify the patient's identity using 2 identifiers. This is crucial to ensure that the right patient is receiving the right blood product, thereby minimizing the risk of transfusion reactions. Remember the mnemonic ID first to remember that identifying the patient is the first step in any procedure. A nurse is managing care for a patient who has been admitted with acute pancreatitis. The nurse is prioritizing interventions based on the patient's severe abdominal pain, nausea, and vomiting. Which of the following interventions should the nurse implement first to ensure a safe and effective care environment? Here are the options. Option 1. Administering an antiemetic to control nausea. Option 2. Providing pain management with prescribed analgesics. Option 3. Monitoring vital signs and fluid balance. Option 4. Educating the patient about dietary modifications. The correct answer is monitoring vital signs and fluid balance. Explanation. The correct answer is monitoring vital signs and fluid balance. In acute pancreatitis, the patient is at risk for severe fluid volume depletion due to vomiting and third-space fluid shifts into the peritoneal cavity. This can lead to hypovolemic shock, a life-threatening condition. Therefore, the nurse's first priority should be to monitor vital signs for signs of shock, tachycardia, hypotension, and assess fluid balance, input and output, signs of dehydration. Administering an antiemetic to control nausea and providing pain management with prescribed analgesics are important, but they are secondary to ensuring the patient's hemodynamic stability. Educating the patient about dietary modifications is a long-term management strategy and not a priority during the acute phase of pancreatitis. Remember the mnemonic ABC, airway, breathing, circulation, when prioritizing nursing interventions. In this case, circulation, monitoring vital signs and fluid balance, is the priority. A nurse is managing care for a 58-year-old patient who recently underwent surgery for colorectal cancer. The patient is scheduled for chemotherapy, but has expressed concerns about the potential side effects and their ability to manage these at home. In prioritizing the patient's care, what is the best initial action the nurse should take to ensure a safe and effective care environment? Here are the options. Option 1. Immediately start patient education on the side effects of chemotherapy. Option 2. Assess the patient's understanding and readiness to learn about chemotherapy. Option 3. Coordinate with a dietitian to discuss dietary changes post-chemotherapy. Option 4. Refer the patient to a support group for cancer survivors. The correct answer is assess the patient's understanding and readiness to learn about chemotherapy. Explanation. The correct answer is to assess the patient's understanding and readiness to learn about chemotherapy. This is because the nurse's first step should always be assessment. Before providing education or making referrals, it's crucial to understand the patient's current knowledge level, emotional state, and readiness to learn. This ensures that interventions are tailored to the patient's needs, which is the cornerstone of patient-centered care and effective care planning. Why the other options are incorrect. 1. Immediately start patient education on the side effects of chemotherapy is incorrect because education should only begin after an assessment of the patient's readiness to learn. Remember the nursing process. ADPIE. Assess, diagnose, plan, implement, evaluate. 2. Coordinate with a dietitian to discuss dietary changes post-chemotherapy is not the initial step. While dietary changes are important, they should be addressed after the patient's understanding and readiness to learn have been assessed. 3. Refer the patient to a support group for cancer survivors is not the best initial action. Support groups can be beneficial, but the patient's readiness to participate should be assessed first. Remember the mnemonic ADPIE for the nursing process to help prioritize patient care actions. Select all that apply. Which of the following are considered vital signs? Here are the options. Option 1, blood pressure. Option 2, temperature. Option 3, heart rate. Option 4, respiratory rate. Option 5, blood glucose. Vital signs include blood pressure, temperature, heart rate, and respiratory rate. Blood glucose is important, but not classified as a vital sign. A patient with a history of chronic obstructive pulmonary disease, COPD, presents to the emergency department with increased shortness of breath and wheezing. The nurse notes the patient is using accessory muscles for breathing and has a respiratory rate of 30 breaths per minute. Which of the following interventions should the nurse prioritize first to stabilize the patient's condition? Here are the options. Option 1. Administer a bronchodilator as prescribed. Option 2. Initiate oxygen therapy at 2 liters per minute via nasal cannula. Option 3. Obtain a chest X-ray to evaluate for complications. Option 4. Place the patient in a high Fowler's position. The correct answer is administer a bronchodilator as prescribed. Explanation. The correct answer is to administer a bronchodilator as prescribed. In acute exacerbations of chronic obstructive pulmonary disease, COPD, the primary issue is bronchospasm, which restricts airflow and leads to symptoms such as wheezing and shortness of breath. Bronchodilators work by relaxing the muscles around the airways, thereby opening them up and improving airflow. This is the most immediate intervention to alleviate these symptoms. While initiating oxygen therapy at 2 liters per minute via nasal cannula is also important, it should be done after the administration of bronchodilators. This is because oxygen therapy is most effective when the airways are open, allowing for optimal gas exchange. Obtaining a chest X-ray to evaluate for complications is not the immediate priority in this situation. While it can provide valuable information about the patient's lung condition, it does not directly address the acute breathing difficulties the patient is experiencing. Lastly, placing the patient in a high Fowler's position can aid in breathing by reducing pressure on the diaphragm, but it is not as immediately effective in relieving bronchospasm as administering a bronchodilator. Remember the mnemonic, breathe before oxygen, BBO, to remember the order of interventions. Bronchodilator, then oxygen therapy. A nurse is assessing a patient who has been diagnosed with heart failure. The patient reports increased shortness of breath when lying flat and has been sleeping in a recliner. Which of the following findings would the nurse expect to assess upon examination? Here are the options. Option 1. decreased lung sounds bilaterally. Option 2, crackles or wheezes upon auscultation. Option 3, bradycardia with a heart rate of 50 BPM. Option 4, decreased peripheral edema. The correct answer is crackles or wheezes upon auscultation. Explanation: the correct answer is crackles or wheezes upon auscultation. In heart failure, the heart is unable to pump blood effectively, leading to fluid accumulation in the lungs, known as pulmonary edema. This condition often manifests as crackles or wheezes upon auscultation, which are sounds produced by the movement of air through fluid-filled airways. Now, let's discuss why the other options are incorrect. The first, decreased lung sounds bilaterally, is incorrect because heart failure typically leads to increased lung sounds due to fluid accumulation, not decreased. Second, bradycardia with a heart rate of 50 BPM is incorrect because heart failure is usually associated with tachycardia, not bradycardia, as the heart tries to compensate for its reduced pumping ability. Third, decreased peripheral edema is incorrect because heart failure often leads to increased peripheral edema due to fluid retention, not decreased. Remember the mnemonic wheezes and crackles to recall the common lung sounds associated with heart failure. What is the appropriate action if a patient is experiencing a seizure? Here are the options. Option 1, hold the patient's arms. Option 2, place a tongue blade in the mouth. Option 3, clear the area of hazards. Option 4, restrict the patient's movement. The correct answer is clear the area of hazards. Enhanced explanation: the correct action when a patient is experiencing a seizure is to clear the area of hazards. This is to prevent injury from falling or hitting against hard objects during the seizure. Option 1, holding the patient's arms, is incorrect because it can lead to injury. During a seizure, the patient's muscles are contracting and relaxing rapidly, and forcibly holding them can cause harm. Option 2, placing a tongue blade in the mouth, is also wrong. There is a common myth that a person having a seizure can swallow their tongue, but this is not true. Attempting to place something in the mouth can cause injury to the patient or the person trying to help. Option 4, restricting the patient's movement, is not the best choice. While it's important to keep the patient safe, excessive restraint can cause injury. Instead, focus on removing dangers in the environment and providing a safe space for the seizure to occur. Remember the mnemonic SAFE. Stay calm, away from hazards, face turned to the side, and ensure safety post-seizure. A 58-year-old male with a history of chronic heart failure presents to the emergency department with symptoms of worsening dyspnea, orthopnea, and bilateral ankle swelling. Which of the following interventions should the nurse prioritize? Here are the options. Option 1, administering oral furosemide. Option 2, performing a 12-lead ECG. Option 3, assessing oxygen saturation and administering supplemental oxygen if needed. Option 4, scheduling daily weight measurements. The correct answer is 2. Explanation: the correct answer is performing a 12-lead ECG. This is because the patient's symptoms of worsening dyspnea, orthopnea, and bilateral ankle swelling indicate an acute exacerbation of heart failure, which could potentially be due to a new cardiac event such as myocardial infarction. A 12-lead ECG is the most immediate and direct way to assess for this. Now, let's look at the other options. 1. Administering oral furosemide is not the priority. While furosemide can help reduce fluid overload, it does not address the immediate need to rule out a new cardiac event. 3. Assessing oxygen saturation and administering supplemental oxygen if needed is important, but it's not the first step. Oxygen therapy can help alleviate symptoms, but it doesn't identify the underlying cause of the exacerbation. 4. Scheduling daily weight measurements is a long-term management strategy for heart failure not an immediate intervention for an acute exacerbation. Remember the mnemonic ABC, airway, breathing, circulation, for prioritizing interventions. In this case, circulation, assessed by ECG, is the priority to rule out a new cardiac event. A nurse is caring for a postoperative patient who has just returned from the operating room following a laparoscopic cholecystectomy. The patient is alert, but reports a pain level of 8 on a scale of 0 to 10. The nurse notes that the patient has a PCA, patient-controlled analgesia, pump set to deliver morphine. The nurse is aware that the patient has a history of opioid use and has developed a tolerance. In addition to assessing the patient's pain level, which of the following actions should the nurse prioritize to ensure the patient's safety and effective pain management? Here are the options. Option 1. Administer the maximum allowable dose of morphine via the PCA pump immediately to alleviate the pain. Option 2. Encourage the patient to use the PCA pump as needed and monitor their pain level closely. Option 3. Consult with the healthcare provider to consider alternative pain management strategies, such as non-opioid analgesics. Option 4. Reassess the patient's pain level in 30 minutes after administering a lower dose of morphine. The correct answer is consult with the healthcare provider to consider alternative pain management strategies, such as non-opioid analgesics. While it is important to manage the patient's pain effectively, the nurse must also consider the patient's history of opioid tolerance and the potential for respiratory depression. Administering the maximum allowable dose of morphine may not be safe due to the patient's tolerance. Encouraging the use of the PCA pump is appropriate, but without addressing the potential risks, it may not be the best action. Reassessing pain after administering a lower dose of morphine does not address the immediate need for a safe and effective pain management plan. Consulting with the healthcare provider for alternative strategies, such as non-opioid analgesics, ensures a comprehensive approach to pain management while prioritizing patient safety. Select all that apply. What are the signs of dehydration? Here are the options. Option 1. Dry skin. Option 2. Increased thirst. Option 3. Decreased urine output. Option 4. Weight gain. Enhanced explanation. The correct signs of dehydration are dry skin, increased thirst, and decreased urine output. Dehydration occurs when the body loses more fluid than it takes in, leading to a lack of necessary water for bodily functions. Dry skin is a sign of dehydration because the body is trying to conserve water, leading to less moisture available for the skin. Increased thirst is the body's natural response to needing more fluids. Decreased urine output is also a sign of dehydration because the body is conserving water, leading to less fluid being excreted. Weight gain is not a sign of dehydration. In fact, it's the opposite. Dehydration often leads to weight loss due to the loss of water weight. Therefore, this option is incorrect. Remember the mnemonic DID for dehydration includes dry skin, increased thirst, decreased urine output. What is the normal range for adult heart rate at rest? Here are the options. Option 1, 60 to 100 beats per minute. Option 2, 40 to 60 beats per minute. Option 3, 100 to 120 beats per minute. Option 4, 80 to 120 beats per minute. The correct answer is 60 to 100 beats per minute. Enhanced explanation. The correct answer is 60 to 100 beats per minute. This is the standard range for an adult's resting heart rate. Option 2, 40 to 60 beats per minute, is incorrect as this range is too low and could indicate bradycardia, a condition where the heart rate is slower than normal. Option 3, 100 to 120 beats per minute, and Option 4, 80 to 120 beats per minute, are both incorrect as these ranges are too high, potentially indicating tachycardia, a condition where the heart rate is faster than normal. Remember the mnemonic 60 to 100, heart's done, to recall the normal resting heart rate for adults. A 32-year-old client with a history of bipolar disorder is admitted to the psychiatric unit during a manic episode. The client is exhibiting pressured speech, grandiosity, and decreased need for sleep. The nurse observes that the client is becoming increasingly agitated and is starting to intrude on the personal space of others. What is the best initial nursing intervention to manage this client's behavior? Here are the options. Option 1. Immediately administer a PRN antipsychotic medication as ordered. Option 2. Engage the client in a one-on-one conversation to discuss their feelings and behaviors. Option 3. Redirect the client to a less stimulating environment and provide calm, clear, and brief communication. Option 4. Arrange for a group therapy session to discuss boundaries and personal space. The correct answer is 2. Redirecting the client to a less stimulating environment and providing calm, clear, and brief communication are effective initial strategies to manage agitation in a client experiencing a manic episode. This approach helps minimize sensory overload and reduce agitation without escalating the situation. Immediate medication administration or engaging in an in-depth conversation might be necessary later, but are not the best initial steps before trying to de-escalate the situation non-pharmacologically. A nurse is caring for a patient with acute pancreatitis who is experiencing severe abdominal pain and nausea. Which of the following interventions should the nurse prioritize to ensure a safe and effective care environment? Here are the options. Option 1. Administering an as-needed dose of an antiemetic. Option 2. Encouraging ambulation to reduce pain. Option 3. Monitoring blood glucose levels every 4 hours. Option 4. Administering IV fluids and pain management as prescribed. The correct answer is 3. Explanation. The correct answer is administering IV fluids and pain management as prescribed. In acute pancreatitis, the pancreas is inflamed, leading to severe abdominal pain and nausea. The priority is to manage these symptoms and prevent complications. IV fluids are essential to prevent dehydration, a common complication of pancreatitis, and pain management is crucial to alleviate the severe pain. Remember the mnemonic PAIN for pancreatitis. Pain management, avoid complications, IV fluids, and nausea control. Option 1. Administering an as-needed dose of an antiemetic is important but not the priority. Antiemetics help control nausea but do not address the pain or potential dehydration. Option 2. Encouraging ambulation to reduce pain is not appropriate. Ambulation may actually exacerbate the pain in acute pancreatitis. Option 3. Monitoring blood glucose levels every 4 hours is important due to the role of the pancreas in insulin production, but it is not the priority intervention in this scenario. The immediate concern is managing pain and preventing dehydration. A nurse is caring for a postoperative client who has just returned from the recovery room after a laparoscopic cholecystectomy. The client is reporting moderate pain at the surgical site, has a heart rate of 110 beats per minute, and a blood pressure of 90/60 millimeters mercury. The nurse notes that the client is diaphoretic and appears anxious. The nurse understands that these findings may indicate potential complications such as hypovolemic shock or inadequate pain management. What is the best initial action the nurse should take to ensure the safety and effective care of this client? Here are the options. Option 1. Administer the prescribed analgesic to manage the client's pain. Option 2. Initiate an IV fluid bolus to address potential hypovolemia. Option 3. Reassess the client's vital signs and notify the healthcare provider. Option 4. Provide reassurance to the client and encourage deep breathing exercises. The correct answer is initiate an IV fluid bolus to address potential hypovolemia. In this scenario, the client exhibits signs of possible hypovolemic shock, elevated heart rate, low blood pressure, diaphoresis. The priority action is to initiate an IV fluid bolus to restore intravascular volume and stabilize blood pressure. While pain management is important, addressing the potential life-threatening condition takes precedence. Reassessing vital signs and notifying the healthcare provider are also important, but these actions should follow the immediate intervention of fluid resuscitation. Providing reassurance and encouraging deep breathing may help with anxiety, but do not address the critical physiological needs of the client. A nurse is caring for a patient who has just undergone a total hip replacement. The patient is experiencing severe pain and nausea. Which of the following assessments should the nurse perform first? Here are the options. Option 1. Check the patient's vital signs. Option 2. Assess the surgical site for bleeding. Option 3. Administer antiemetic medication. Option 4. Evaluate the patient's pain level. The correct answer is check the patient's vital signs. Explanation: the correct answer is to first check the patient's vital signs. This is because vital signs are a primary indicator of a patient's overall physiological status and can provide immediate information about potential complications such as shock or hemorrhage, which could be life-threatening. Assessing the surgical site for bleeding, option 2, is important, but it's secondary to checking vital signs as it focuses on a specific area rather than the overall condition. Administering antiemetic medication, option 3, and evaluating the patient's pain level, option 4, are important steps in patient care, but they are not the first priority. Remember the mnemonic ABC, airway, breathing, circulation. In this case, circulation, vital signs, takes precedence. A nurse is caring for a patient who has just been diagnosed with a deep vein thrombosis, DVT, and is being started on anticoagulation therapy. Which of the following assessments should the nurse prioritize in order to monitor for potential complications associated with anticoagulation therapy? Here are the options. Option 1. Monitor the patient's hemoglobin and hematocrit levels. Option 2. Assess the patient's extremities for swelling and pain. Option 3. Evaluate the patient's renal function. Option 4. Check for signs of respiratory distress. The correct answer is monitor the patient's hemoglobin and hematocrit levels. Explanation: the correct answer is to monitor the patient's hemoglobin and hematocrit levels. Anticoagulation therapy increases the risk of bleeding, and a decrease in these levels can indicate a bleeding event. A mnemonic to remember this is H and H for hemorrhage. Assessing the patient's extremities for swelling and pain, option 2, is important for monitoring the DVT itself, but not directly related to complications of anticoagulation therapy. Evaluating the patient's renal function, option 3, is also crucial in general patient care, but it's not the priority in this case as anticoagulants primarily affect the blood's clotting ability, not kidney function. Checking for signs of respiratory distress, option 4, is important in many situations, but it's not the primary concern with anticoagulation therapy. This would be more relevant if we were considering a pulmonary embolism, a potential complication of DVT, but not directly related to the anticoagulation therapy. A nurse is caring for a patient with acute pancreatitis. Which of the following laboratory values should the nurse monitor most closely? Here are the options. Option 1, serum amylase. Option 2, complete blood count, CBC. Option 3, lipase levels. Option 4, blood urea nitrogen, BUN. Explanation: the correct answer is serum amylase. In acute pancreatitis, the pancreas becomes inflamed and its cells release enzymes including amylase into the bloodstream. This results in a significant increase in serum amylase levels, making it a critical indicator of this condition. Monitoring serum amylase levels allows for timely detection of disease progression or improvement. The other options are not as directly related to acute pancreatitis. A complete blood count, CBC, can show signs of infection or inflammation, but it is not specific to the pancreas. Lipase levels can also increase in pancreatitis, but they are not as sensitive or specific as amylase. Blood urea nitrogen, BUN, is primarily used to assess kidney function and hydration status, not pancreatic inflammation. Remember the mnemonic, a pancreas makes amylase, to help recall that serum amylase is the most important lab value to monitor in acute pancreatitis. Which of the following is a contraindication for administering a live vaccine? Here are the options. Option 1, pregnancy. Option 2, recent infection. Option 3, age over 2 years. Option 4, allergy to eggs. The correct answer is pregnancy. Explanation: the correct answer is pregnancy. Live vaccines are contraindicated in pregnant women because they carry a theoretical risk of transmitting the virus to the fetus, potentially causing harm. Recent infection is not a contraindication for live vaccines. In fact, vaccines can be given after the acute phase of illness. Age over 2 years is not a contraindication either. Many live vaccines are recommended for children older than 2 years. Allergy to eggs is a contraindication for some vaccines, but not all, and it is not specific to live vaccines. Remember the mnemonic, pregnancy prohibits live vaccines, to help recall this important concept. A nurse is caring for a 65-year-old male patient who has just been admitted with acute exacerbation of chronic obstructive pulmonary disease, COPD. The patient is experiencing increased shortness of breath, wheezing, and a productive cough with green sputum. The nurse notes that the patient's respiratory rate is 28 breaths per minute. Oxygen saturation is 88% on room air, and he appears anxious. The healthcare provider orders a nebulizer treatment with albuterol and ipratropium, as well as a chest X-ray. After administering the nebulizer treatment, the nurse should prioritize which of the following interventions to ensure optimal patient outcomes. Select the best answer. Here are the options. Option 1. Reassess the patient's oxygen saturation and respiratory status after 15 minutes. Option 2. Administer a dose of oral corticosteroids as prescribed. Option 3. Encourage the patient to use pursed lip breathing techniques. Option 4. Obtain a complete blood count, CBC, to assess for infection. The correct answer is reassess the patient's oxygen saturation and respiratory status after 15 minutes. Reassessing the patient's oxygen saturation and respiratory status after administering the nebulizer treatment is crucial to evaluate the effectiveness of the intervention and determine if further action is needed. While administering corticosteroids and encouraging breathing techniques are important, the immediate priority is to monitor the patient's response to treatment. Obtaining a CBC may be necessary later, but is not an immediate priority in this acute situation. Order the steps for taking a patient's blood pressure. Here are the options. Option 1. Place the cuff around the arm. Option 2. Inflate the cuff. Option 3. Listen for the heartbeat. Option 4. Deflate the cuff. Explanation. The correct order for taking a patient's blood pressure is as follows. 1. Place the cuff around the arm. 2. Inflate the cuff. 3. Listen for the heartbeat. 4. Deflate the cuff. First, you must place the cuff around the arm, ensuring it's snug but not too tight. This allows for accurate measurement of the pressure in the brachial artery. Next, you inflate the cuff. This temporarily stops the blood flow, which is necessary to measure the systolic and diastolic pressures. Then, you listen for the heartbeat using a stethoscope. As you slowly release the pressure in the cuff, the first sound you hear is the systolic pressure. The point where the sound disappears is the diastolic pressure. Finally, you deflate the cuff completely. This allows blood flow to return to normal. Remember the mnemonic PILLED, place, Inflate, listen, deflate to help you recall the correct order.
That's all for today's 25 NCLEX style questions. When you finish, you'll see your score alongside a full breakdown of answers and rationales. This video was powered by ExamASAP in collaboration with YourNursingSpace, and it will entail your go-to for NCLEX case studies, past exam history, cheat sheets, and progress checks. Thanks for watching. Drop a comment below to let us know how you like this question bank and any feedback you have. We update the platform daily based on your suggestions. See you in the next one.